And I respect what the laser is able to do, and the embellishments that Dr. Carpenter's been able to make with her patented procedures that she's come up with, and the length of time that she spent in doing it. And I can't help but think that, why would somebody who is being chastised by the medical community, which I know full well how that goes, because me and my husband also were very pioneering in our surgical skills and did a lot of procedures that the patients absolutely loved and adored, because we were able to achieve results that the medical community had not passed what they call their standard of care, which means what everybody else is doing. So if somebody comes up with a better idea, but everybody else is not doing it, which is a conflict of interest right there, how can everybody else be doing it if it's something brand new and innovative and pioneering and better for the patient? How can you ever come up with a better way if it's not, quote, the standard of care, which is what everybody else is doing? Then you're okay. But if you start to rock the boat and you start to say, what if we did it this way, and the patient's able to have much less comfort and much better results, and the patient is not so traumatized or is not so incapacitated? What about if we did it this way? And what you hear from the medical community is, well, it's not the standard of care. It's not what everyone has been doing, is doing, and on top of that, to read between the lines, it gives you an unfair advantage because you're going to steal our patients. And I hate to be so blunt about it, but I think that's just the best way of putting it is just there is definitely a status quo out there, and woe be it to somebody who thinks a little bit more with a pioneering spirit and wants to help the medical profession move forward. It's very difficult because of the standard of care. It keeps everybody on a par, which absolutely keeps us all years backward of what we might become if we were able to look individually at what the good Lord blessed different achieving pioneers as far as innovative ideas that might change and revolutionize the way that we treat patients, medically speaking, if we would just investigate and look with an open mind as to what's out there. And you have to realize that every idea that God gives medical professionals is there for a reason. And if it's there for a reason, this is His gift to us to research and to take under advisement and to study and to experiment with, not just close the lid on and say, well, we haven't done it this way before, therefore I don't think we should do it this way from here on forward. It would be something scary and new and different. Well, what do you think the patients are going through when they're being told they have cancer and it's something scary and new and different? And just leave it to us. We'll take good care of you. Well, you know what? The cancer statistics are not telling us that we're being taken good care of. Yeah. So I think that's kind of, I don't want to speak too long on that, and if there's any portion of that you want me to elaborate on, I'd be happy to. But
but you can tell him. You can tell him what year you came, and then how long ago it was that you left after the treatment.
Sure, be happy to. I was diagnosed in 2006. I came to you a year later in 2007, and I just had my latest ultrasound, and this is a whole other can of worms, but I'll take a minute, if you don't mind, for me to talk about.
Please.
The only way, obviously, that you can get an ultrasound or any kind of a follow-up to this type of treatment is to see an oncologist. At least that's what, in this neck of the woods, is told to me in my state. And so I have to go in to see a oncologist and listen to all the threats and the rationale that, again, too, I'm acting out of the standard of care and I'm doing something different, and it probably will mean my life, and the cancer probably has already spread, and why don't we just listen to reason and do what everybody else is doing? And I hear this at least 3-4 times a year, which is how often I have been going in, and I say that. I know it's not anything that Dr. Carpenter recommends, and even though I trust her and I trust the good Lord that I am healed, praise God, I have been following it up. I told you I had an analytical mind, so I've just got to go ahead and appease that side of me. So I will tell you that with all the ultrasounds that I have had over the years.
Wait a minute, we got to come back after the break again. Okay, we are back, and we want to hear the details on the ultrasound because that's also a very touchy issue. Okay, go ahead, Dr. Evelyn.
Okay, so I've had 6 of them in the 3-year period, and I've just finished my last one, as I mentioned, with the previous one I had about 6 months ago. And the pathway of what this tumor shape and size has done It was approximately 2 centimeters all around when I first started. It has gone down immediately after treatment to about a half a centimeter, so from 2 centimeters to half a centimeter is quite something. And then it started to go up just a little bit, and then it kind of varied shape. But since the last treatment, and actually, the last ultrasound, the last 2 ultrasounds, which takes us back a good year and a half ago, this most recent one was again smaller. And I'll quote you from the ultrasound report. It says it has not significantly changed. And I would like to probably question any cancer doctor as to any type of a growing tumor that's supposedly malignant. When can you ever say that a tumor is significantly not changed if it's a cancer? I mean, the very definition of cancer is a growing, active, cannot stop multiplying type of a cell. So how can you say it's significantly not changed over a year and a half if indeed Dr. Carpenter's method is not working? Also, through the course of going through the conflict with the doctors, they've told me that the lymph nodes were enlarged immediately after the procedure, and I needed to have them taken out immediately because they're probably full of cancer. And I told them, as far as what Dr. Carpenter told me, they're digesting away the dead tumor, and it's not unusual for them to enlarge. Well, that was a big battle in itself, but I stood the ground and held firm, good Lord willing, and did not have the lymph nodes removed. And again, too, I'll quote you from the most recent ultrasound report that says the benign appearing lymph nodes. So I would have had a totally unnecessary surgery, yanking out lymph nodes that can only help me with fighting my cancer had I listened to them. Other tests that they wanted me to do was a breast-specific gamma imaging test, and they said that's definitely going to tell us whether the tumor's alive or dead. Well, I already knew it was dead, so it was not something I was anxious to get. It was also something that was brand new to our local hospital, so I called again all over the country trying to find out people who had had this test and what it would show in my particular instance, and got the answer that the BSGI, or breast-specific gamma imaging, would not be any more helpful in our specific instance because
Absolutely.
They didn't know what the results of my dead tumor would show. So again, too, I just the final word of caution I just have to leave your listeners with is to double-check, to research. I know it takes time. I know it takes effort, and I know sometimes I've said numerous times over the past 3 years I feel like a salmon swimming upstream, but, you know, unless you're the one to ask the questions and rock the boat, no one's going to do it for you. It's your body, and I think what we're up against is not just having the cancer spread, but the tragic results of having your body filled with poisons. And trying to come back to a healthy situation from that is just against all odds. And I do thank the good Lord that He led me to Dr. Carpenter, and I think it was an absolute godsend. And I do pray for her every day and the patients that she's able to touch. And I can't say enough about what the procedure has meant to me. I would do it all over again today, 3 years later. And I just continue to look forward to the good Lord blessing the results, that this tumor will continually shrink and then just eventually disappear. But it is a battle, and I don't think she'd be fighting it unless she knew how important this was to saving lives and to changing people's lives to know that they don't have to comply with what the traditional run-of-the-mill answer to cancer is, which is surgery, radiation, and chemo. We hear too much of that, and every person is entitled to make a decision for themselves what they feel they need to do with this temple of the Lord that we've been blessed with. And health is such a precious commodity that it just makes me thank the good Lord every day that He has healed me, and maybe it was just for this show to talk to your listeners, Dr. Carpenter. I don't know, but I feel each day is a blessing, and I can't thank you enough.
Thank you. You want to discuss the chocolate joke, our chocolate joke?
Well, after going through my alternative measures, which were quite drastic, at one point I was drinking 12 cups of fresh organic carrot juice a day, and that was the only thing I was practically eating for months at a time. And I was so paranoid and fed up with trying to cure this thing with the diet that when I went to Dr. Carpenter, she said, you know what, go and live your life and go eat some chocolate. And boy, that was one of the first things that I did. So every time I go down to see her now, I make sure I have some chocolate to give her just as she gave me my life back, and I celebrate each day, and we celebrate with chocolate, Dr. Carpenter and I do. And
That was great. I'm really happy. Okay.